I'm Jerica and I'm back for another video. Thank you so much to everyone who watched my first Pacific Cross video, and because you've had a lot of inquiries and questions about our plans, here's a video for the frequently asked questions of Pacific Cross Select plans. Before I start, I want to thank everyone who inquired and who has already gotten their Pacific Cross Select program. I think this is really one of the best medical insurance programs here in the Philippines. So thank you so much for the trust. I also want to thank those who already downloaded their personal finance playbook. You can access the playbook in my website. That's finance-playbook.com, and in that playbook you will learn about having offensive and defensive financial strategies when it comes to your personal finance. Let's get to the questions. First question, what's the difference between Select Plus and Select Standard? Well, basically with Select Plus, there is an aggregate limit that is replenished every year. So if you are Select Plus Ward, you have 500,000 aggregate limit per year that is replenished for next year. If you are semi-private, that's 750,000 pesos. And the highest is Select Plus Private, which is 1.5 million pesos every year, and that coverage gets replenished. With Select Standard, coverage doesn't get replenished because it is disability per lifetime. So it's also a good program, but the difference is if you have some pre-existing conditions, it's not advisable. Your program will not be replenished on the next year. So the next question is, can you switch from Select Standard to Select Plus? Yes, you can switch it, but you can't switch it in the middle of the year. You have to wait until you renew your policy. And there's also a condition when you switch it. So I have this example if you want to switch from Select Standard to Select Plus. So here in year 1, you are, for example, Select Standard Ward. In year 2, during your renewal, you want to upgrade to Select Plus Private. So if you have dengue, for example, and you utilized your program for dengue, during the transition year, your maximum benefit limit will still be 500,000 because it was in the ward category. The benefit that you have for dengue will only be 200,000 pesos since 300,000 was already utilized. During the transition year, the new plan's inner limits can apply. So we'll cover for the private room, but still subject to the benefit limit of 500,000. The good news is, on the third year, the maximum benefit limit and inner limit of the new upgraded plan will apply. So in case of any pre-existing conditions, it will now be 1.5 million per year, and there won't be any more limits. Next question, is it possible to switch from a lower plan like a Select plan award to a higher plan, which is private, or Blue Royale? And the answer is yes. So Blue Royale is actually our premium program. The minimum coverage is about $500,000 and the maximum is about $1 million. Another common question is, does this include maternity benefit? Well, Select programs do not include maternity benefit, but Blue Royale programs do. To learn more about Blue Royale programs, please message me. So just to expound more, or if you really want to get into the policy and learn about the terms and conditions of the benefit limit upgrade, which is basically what I mentioned a while ago. What this clause is saying, that during the first 12 months or during the transition year, when the client wanted to upgrade or upgraded his plan, the maximum benefit limit should not exceed the previous year. So yeah, if you want to learn more about this, or if you're still confused, please drop me a message in my facebook.com/financeplaybook. The next frequently asked question is, are pre-existing conditions covered? So pre-existing conditions is like one of those things that I wish everyone knew so that I don't have to spell the entire word anymore. Pre-existing conditions can be covered on the first year subject to premium loading, but most or some of the pre-existing conditions that I will explain later won't be covered on the first year and will be subject to a 12-month waiting period. So it will be covered on the second year. I'm gonna define pre-existing conditions here. Basically, these are disabilities or illnesses that existed before the policy effectivity date or before you even applied for the policy. What's important here is you should note that whether or not insured was aware of such illness or condition, it can still be classified as a pre-existing condition. So here are the common PECs that are not covered in the first year, and that includes cancer, tumors, diabetes, tuberculosis, cataract or glaucoma, etc. So on the first year, these will not be covered, and it will be an option for the insured to cover it on the second year, subject to premium loading and inner limits. Basically, premium loading is additional payment for Pacific Cross to cover the pre-existing condition. We also have other clauses on annual premium increase. So as your age increases, the premium for your select plans or for your medical insurance also increases. So other things that would increase your premium would be premium loading and also utilization. More on that when you schedule a one-on-one consultation with me. If these PECs are not covered in the first year, what is covered on the first year? This list is not exhaustive, but basically diseases that, will not be considered pre-existing. Bacterial and viral infections, accidents, because, you'll never know. So yeah, a lot of people are like, grabe, ano nang covered if hindi covered yung pre-existing condition? Then obviously, a lot pa rin can still be covered. And as I mentioned a while ago, low-risk pre-existing conditions may be covered on the first year, subject to premium loading. The next frequently asked question is, what do these core benefits cover? And basically, it's just inpatient and emergency hospitalization. So, for example, you have a ward, and what's included in that is for you to stay in a ward room, and your inpatient and emergency hospitalization coverage will already be covered up to 500,000 pesos. If you're gonna ask me, included ba yung outpatient na consultation? For the core benefits, it's not. The next frequently asked question is, meron bang annual physical exam? And yes, this actually for me compensates the lack of outpatient benefits in the core benefits, because there is an annual physical exam which is super important for you to determine the status of your health. And what's inclusive in the annual physical exam? These are the urinalysis, x-ray, etc. And the last frequently asked question is the riders or the optional benefits. And we have two, that is the outpatient benefit and the dental benefits. For the outpatient benefits, there are two types, that's standard and executive. So if you want 25,000 worth of outpatient benefits, that includes the consultations, the chiropractor, the x-rays and lab tests, and the medicines and drugs. If you want to reimburse your medicines, and if you think that it goes to about 25,000 or about 50,000 per year, then I would really advise having this outpatient benefit as a rider. You have standard, you have 25,000 pesos worth of outpatient benefits. If executive, it's 50,000 pesos. And another thing, the outpatient benefit is by reimbursement only. At least you can go to any medical provider and just have the necessary prescription, the necessary labs, etc., so that your reimbursement will be approved. The reason why it's only 80% is because we want to keep our premiums low, and people have been abusing this outpatient benefit. Like, they just want to go to the hospital and get checked, but there is a cost for that, and to prevent the abuse of this outpatient benefit, we only cover 80%. So before I end this video, final reminders: if you do want to get a quote, you don't have to go very far. You just need to go to the brochure. If you don't have any pre-existing conditions, we usually apply a brochure price. This is what it costs for the core benefits, which is inpatient and emergency. If you want to add optional benefits, which is the outpatient and the dental benefits, it's what it is according to your age. If you want to have executive outpatient benefits, which is 50,000 per year, then this will be the price. So there goes my second Pacific Cross video. Thank you everyone who listened up to this moment. And of course, if you do have more questions when it comes to Pacific Cross, please head on to my socials and you can reach me there. Before I leave, don't forget to download your free personal finance playbook in finance-playbook.com. And in that playbook, you will learn about the offensive strategies, which involves goal setting, investing in income-generating assets, and other stuff. When it comes to the defensive strategies, these are medical insurance, income protection, and of course, debt management. So if you haven't yet, download the playbook in finance-playbook.com. And as always, hit that like and subscribe button, click on that notification bell for my new videos, and I'll see you in my next video.